Good morning. It's Bernard Nomberg with the Nomberg Law Firm. We're back on another Tuesday, Nomberg Law Live. Today we're talking about sports concussions in youth athletes, and I'm extremely pleased to have with me today two experts in this field. I've got Dr. Emily Casey. She is a sports medicine physician with the Andrews Sports Medicine and Orthopedic Center here in town. I also have Dr. Joseph Ackerson, a pediatric neuropsychologist with Ackerson and Associates, also in the Birmingham metro area. Good morning to you both.
Good morning.
I hope that you guys are, wherever you are, I know that we're doing this through an online app. We're not actually together. We've got snow coming. I hope you both are warm and safe today. I know that through our previous talks, we've discussed that you guys take a multidisciplinary team approach to better manage and treat sports concussions, which is something that all parents with children and who are not only the young ones, but as they grow older, need to be more and more familiar with. Sports are a huge part of our Birmingham metro area. Dr. Casey, I know you see them every day, kids who have various ailments, and Dr. Ackerson, I know you're very familiar with concussions and the current protocols, and that's what we want to get into today. Dr. Casey, let's start with you. Tell us a little bit about sports concussions.
So a sports concussion is a type of traumatic brain injury that occurs when you take a blow to the head or to the body, and that force is transmitted to the head. The brain then shakes in the skull. This causes a functional impairment or injury, not a structural injury, meaning the brain function is impaired. So our standard neuroimaging CT MRIs will be normal, but that doesn't mean you don't have a concussion. This can occur in any sport or recreational activity. It's more common in males with football and females with soccer, but it can occur in hockey or basketball also. It is important to give our younger athletes a little bit more attention. I mean, everyone needs attention, but they may take a little longer to heal from these injuries because they're younger, their brains are still developing. And the CDC, Center for Disease Control, has reported about an estimated 4 million concussions occur with sports and recreational activities each year. And this is shown to be about a 60% increase over the past decade.
Wow. If I haven't mentioned it previously, I apologize. For those of you who are watching us live, below, if you have questions for either of these two experts, please put them in the comments section. We'll be glad to get to them as we go through this. And after the broadcast, I'll put the contact information for both Dr. Ackerson and for Dr. Casey in case you have further questions. Dr. Casey, I know that more and more information is out there about concussions and what coaches and parents should be on the lookout for. Certainly the professionals in the medical fields who are on the fields and deal with the injuries in the clinics and in the hospitals are learning more and more. But tell us just from your observation, because I know you're on the sidelines on many Friday nights during the fall, and you have two children who are active in sports. Are coaches and team leaders, are they becoming more knowledgeable in being able to identify concussions?
Definitely. I think due to the Alabama sports concussion law that was developed in 2011, everyone is more knowledgeable. Players watching their own teammates, coaches, teachers, parents, and other physicians who may not treat this all the time, at least are more aware of this. And I do think we do a better job of recognizing the signs and symptoms of a concussion or potential concussion, and then we can pull that athlete from play and start our treatment and diagnosis planning. One thing I think we could work more on, and I think in our sports teams that I work with and Dr. Ackerson, we do a good job of this, but we need to work on this out in the community, is a more comprehensive management program for athletes after a concussion, especially those who may need more follow-up care. And by that, we're talking about the return to think and return to learn, because those are important aspects. And Dr. Ackerson works with me closely on developing those plans.
Thank you, Dr. Casey. Dr. Ackerson, tell us a little bit about it. I know that we see stuff, most news are dealing with professional athletes. Cam Newton took a vicious hit a few weeks ago, and we all saw him dazed on the field. And I've recently written about this, that the NFL certainly needs to continue to address and do a better job. Certainly the equipment, the protective gear, it gets better every year. But stepping back away from the NFL and the professionals, and we're focusing on middle school and high school youth for our topic for today. Talk to us a little bit about improvements that you've seen with equipment, with protocol, the testing that goes on. Share with us your knowledge a little bit about those areas.
Well, I think the first thing that we need to point out is there are recent technological advances in helmet design. Those are not yet available to the younger athletes. Those are currently developed for people of the size and the mass of your college or your professional football player. And we are making some important advances in that area. Matter of fact, UAB was an integral part of developing some of the testing protocols and some of the materials that are being used in the latest generation of helmets. But nothing is going to make a better difference or a bigger impact than proper rules and proper rule enforcement. And that is something that we need to have at all levels of play. The NFL is not yet where we need to be in terms of concussion recognition, prevention, and management. But if we could at least take some of those protocols and convince youth coaches that they need to be treating their quarterbacks and their elite athletes the same way that we're treating them at the higher level. The reason why is that the younger the brain, the more vulnerable it is. And yet the kind of care that the youth athlete gets is far inferior to the kind of attention that they're getting if they're at a top high school, college, or professional program.
Thank you for sharing that. I know that Dr. Casey and you have spoken on panels in the past. I know that we all know how important sports are in Birmingham in the South, and it's only growing in the number of sports that are being offered. And it just seems like there are more and more athletes who are then exposed to the potential of being hurt, but it also gives me great comfort that there are folks like you guys in the community to be able to share your knowledge and expertise. This question is for either of you, have you noticed an increase in the number of parents, coaches, league officials, whatever league it may be, who have come to you for advice or that you've spoken to, and that there is an increase in the knowledge being spread out amongst the community on this issue?
Well, I can address that. I chair the Alabama Statewide Sports Concussion Task Force. And in our efforts, we try to do a lot of community outreach and community education. And we're actually available to any group at any time that wants us to come in and educate them. I have most of my contacts have been through the Alabama High School Athletic Association. We have had other local school programs that have contacted us about coming in and reviewing their concussion protocols and discussing ways that they can improve care. There have been some recent initiatives through Andrews Research Institute that they have been developing total safety protocols for coaches, youth coaches, to be aware of and to follow. And Coach Jack Crow, I know, has been very involved with that. And we've actually had some legislation that's been introduced trying to promote greater education and awareness of not only recognition of concussions, but changing how we practice. And by changing how we practice and changing the way that the game is played, we can significantly reduce the risk of brain injury in these young athletes.
Thank you, Dr. Ashley. Dr. Casey?
Yes, as a team physician for high schools and a local college, we review the concussion protocols. We have meetings each year about our head and neck injuries and how we would handle those, and do we need to update our protocols. And so my partners, who are also team physicians, are doing the same thing with the schools that we cover. And again, we are available if other high school coaches or other people who are teaching youth have questions, and we do put on programs for that. And I do always tell people there's great information too at the CDC and Heads Up program that I know a lot of coaches who do coach youth athletes or these rec leagues have to at least look at and review and have a signed certificate from.
Very glad to hear all of that from both of you. I want to pause for just a minute. We've got several listeners. We actually got our first question for you too. Want to say hello to friends watching right now. Morris Lilienthal up in Huntsville, Ron Raquel, Dad, thank you, Dad. Nick Rashwain out in California is watching right now. Hello to all of you. Our first question is from one of the viewers, Bo, I hope I pronounced your name correctly, Bo Shirey. And here's his question for either of you to respond to. What do you do when a pediatrician clears an athlete after a concussion without the return to play protocol? Then the coach gets mad when he gets a clearance note to play from the MD. But as an athletic trainer, we hold them out until they've completed the return to play protocol. I'm sure that's a very common thing that happens.
So for me, especially if I am the team physician, and sometimes, my athletes, they may have had an injury on the weekend and maybe they did not go to the ER, they saw an urgent care, their primary care physician. My or the athletic trainers that I work with, and we work with an injury sports medicine, are our first line of recognizing these issues, and they keep me informed. So I at least see these athletes, whether it's in the office or at the school, and we make sure that they have no symptoms, that they are able to sit back in class and listen and learn and do their homework, and then we'll go through the return to play protocol. So I have I get to oversee those issues. But I do think that athletic trainers, if they feel like they got a note, maybe from someone who cleared the athlete or really doesn't have as much contact with the athlete, and the athlete is not ready to be cleared, I think the athletic trainer, they do a great job of recognizing the signs and symptoms, and the athlete may not be as ready. And this is where I think teachers come into play too. If their student is not able to focus and listen in class, then a clearance note, you shouldn't just take a clearance note. You should be able to finish out the protocol and get the patient back to that doctor or their team doctor and have further evaluation to make the best decision.
I think that this is a great opportunity to educate. We have spent a lot of time trying to raise the level of competence of physicians statewide in Alabama anyway, primary care physicians, sports medicine physicians, et cetera. But a couple of things. One, if your team has a team physician associated with it, you have a greater continuity of care if you're working through the athletic trainer and the team physician. Now, not all schools are going to have that. I would also like to point out that certified athletic trainers are not just people who are there to tape ankles. They're not just there to make sure people are lifting correctly. These are highly trained sports medicine emergency personnel. They have a lot of skills, a lot of training that allow them to do a very good job when they're working in close concert with the physician. So if this is an athletic trainer that is noticing that a physician has cleared somebody too early, I would strongly encourage the athletic trainer to contact that physician and provide some education. Not all primary care physicians have the background that they need in order to clear somebody. But this is a great opportunity to let them know what is your return to play protocol, what are the standards, and by doing that, we are constantly improving the standard of care for all of our young athletes.
Thank you both. We've got a couple more questions that have just come in. Nick asks, should concussion protocol be applied across the board in all athletics, or does it change from sport to sport?
It should not change from sport to sport. Matter of fact, in Alabama, we wrote the law specifically to address all athletic activities. We didn't even use the word sport because in some places cheerleading is legally not necessarily considered a sport because of Title IX rulings. But obviously cheerleading is an athletic activity that can result in pretty significant concussions. Any youth athletic activity can result in concussions. Any one of those should be following the proper concussion protocol. That's what Alabama state law says. And if you're in a state other than Alabama, I would check with your state law. And if it doesn't include it, I would encourage you to contact your legislatures.
I agree. I treat every concussion or injury like this the same, whether it was any sport or any recreational activity.
Okay. Morris asks, and this is for you both, is there more of a danger for a child to receive a concussion in comparison to an adult? And along those lines, is there a different protocol when you compare high school versus college versus pro. I don't know if you guys have had experience with on the pro level. Maybe you have, maybe you hadn't. But I throw that question to either of you.
I have had experience at all three levels. I usually just see people that are college age or younger, but I have had the opportunity to take care of some NFL players as well. The younger the brain, the more vulnerable it is. So we are most concerned actually by the school age athletes. But and the older you get, the more you have the capacity to withstand force, and your brain is more mature, more fully developed. At the same time, the kind of force that you're going to be expecting in certain contact sports, such as football and soccer, increases with greater size, greater age, greater training. So there's a little bit of a trade-off, but generally speaking, the younger the brain, the more vulnerable it is, and therefore you need to be even more conservative in your protocols. You need to be maybe a little bit slower to return a younger child back to play, and certainly if they are still in school, you have to pay very close attention to their educational needs with what we call the return to learn or the return to think protocol.
Dr. Casey, anything to add to that?
Just again, in the NFL, their work is their playing and their football, so you won't have to maybe necessarily worry about homework and grades and returning to the classroom. So in our youth and our high school and our college, we're also trying to make sure, as Dr. Ackerson said, that we are trying to have a return to think protocol and a return to play protocol. And when I have more of those complicated type of concussions where the symptoms are lasting longer than 2 weeks, I can't I get reports that the athlete can't stay in school all day, still can't concentrate to do homework, then that's when I work even closer with Dr. Ackerson on a better return to learn protocol. And it may be that, and he can elaborate on this, but it may be that they go to school so many hours a day or can only do so much homework. If he has anything to add to that.
Certainly, we do a couple of ways of approaching the return to learn protocol. One of those is we're looking at what educational level the person is. It's a little bit easier to hold a younger child out of school for a week or two than it is the college athlete, for example, just because of the pace of instruction. At the same time, we can reduce the amount of workload, which is very important because they're missing school. We also ask schools often to do what we call forgiveness, which means if they don't absolutely have to do the makeup work, don't force them to, because as their brain is still recovering from the injury, now they're having to pull double load academically if you're not reducing their overall workload for them. So it's important that we recognize that any effort, physical effort and cognitive effort, can exacerbate recovery from a concussion. And if we want them to have the quickest, most complete recovery, we need to attend to their mental needs, their academic needs, just as much as we need to attend to their physical needs. Some of the recommendations that we make will also be based on the specific symptoms. For example, some clients will get headaches if they're trying to do math work. On the other hand, they find reading not overly stressful for them. So you really have to take each case individually and design what's called an individual plan for them as they're trying to return to learn.
Thank you, Dr. Ackerson. Dr. Casey, is this what you guys have just been describing? Is this the multidisciplinary team approach for concussion management?
Yes, it is. And again, it starts with the certified athletic trainer who is at the school, on the field, at practice, and at every game. They recognize an injury or symptoms and pull that athlete from play, and the athlete is not allowed to return to sport the same day. And then from there, the certified athletic trainers will set up an appointment with myself and my partners where we can do further testing, evaluation, and diagnose and confirm a concussion. And then again, from there is when I do mental and physical rest. I may keep them out of school a few days, decrease homework, no test. And when the athlete has no symptoms, can sit in class and think and learn, then we do our 5-day return to play protocol. But again, on any of the complicated cases, and each case is different, they may not have headache, they may have blurry vision or focus issues with concentration. And so they may need long-term follow-up for those things, or physical therapy for balance, or visual therapy. And that is, again, where then Dr. Ackerson and I work closely together to try to figure out where is the impairment and what is the next step that we need to do.
Dr. Ackerson, any additional insights on this?
Well, I just want to point out what Dr. Casey was referring to. There's actually a whole team of specialists that you can bring to bear on any individual specific case. There are sports medicine physicians, there are brain injury specialists, I work with vision specialists who are specifically trained in assessing concussion, working with physical therapists familiar with vestibular therapy, for example. So there are a lot of different experts that can be brought into place when needed. What you really need to have, every team needs a quarterback. And the quarterback of this team would be Dr. Casey. It's going to be the team physician that's working with the kid, who knows them and has their eyes and their ears, or the athletic trainer that knows the kid even better because they're seeing them every day. So you really need to have this integrated level of care with the ability to access as many specialists as you need to wrap around the kid to help them. But you also need to have a team at the school. You need to have teachers, and you need to have the school counselors and the school principals all on board. You need the athletic team. You need the coaches to be completely on board. So wherever you're working with the kid, you need the people at that area to understand the significance of the concussion, who the other team players are, and how we can all work together to promote recovery.
I know that it's dangerous to just get on the internet and start reading things. If you don't know where you're going, you might not be reading proper content, and your mind can wander, and then you're really off base. Dr. Casey, do you have any suggestions that when parents are at home and they really just don't have all the answers just yet, are there certain websites, are there certain places that you guys recommend that the parents can go read either before or after they've met with you or Dr. Ackerson and putting a plan in place?
So I do think the CDC has a lot of information about concussions, signs, symptoms to look for, when things may be more dangerous, vomiting, lethargy, when they need to, yes, go to the ER and not wait till the next day or later to see a physician. There are a lot of resources, and I think Dr. Ackerson has some that he uses too, but there's a great heads up program with the CDC. And so there is a lot of information that you can go to that would be correct to look at.
That's
Dr. Ackerson, do you?
Yeah, I was going to say, I think the top website is probably the CDC Heads Up program. They have developed excellent materials for whether you're a coach or a teacher or a primary care physician, anybody that's going to be working with the athlete. They have excellent information available. In Alabama, we have a website. It's alabamatbi.org. And that is a website that is sponsored by the Alabama Department of Rehabilitation Services, which sponsors the Alabama Head Injury Task Force and the Sports Concussion Task Force. That is a place where we put the latest laws and the latest information and local contact information within the state of Alabama for people to access. The Alabama High School Athletic Association also has some concussion-specific information on their webpage as well. So there are a number of excellent resources for people.
And we'll put links to those websites and those resources in the comments section of our broadcast here after we're finished here today. Excellent information, guys. You both are such experts in your respective fields. Thank you for sharing such useful and excellent information that parents, coaches, teachers alike can all use. Dr. Casey, if parents have issues, if they're concerned about their child maybe having some of these symptoms and they want to come in to be evaluated, how can they get in touch with you and your team?
So our telephone number is 205-939-3699, and it's andrewsportsmedicine.com is our website. And we have information on our website also so that you can make an appointment online, and you can call our office, and we'd be glad to help you.
And you guys have clinics set up for this in different parts of the city in the metro area?
We do. We actually have some satellite clinics. Our main campus is at downtown St. Vincent's location. We also have a Pelham office, a 280 office, a Gardendale, and a Trussville office.
And going to the website, I'm sure folks can figure out which clinic and location is closest to them. And again, we'll put this information in the comments section. Thank you, Dr. Casey, for that. Dr. Ackerson, same question for you. If folks feel they need your area of expertise and want to consult with you, how do they reach out and find you?
Well, we have a website. It's it's Ackersonandassociates.com, and they can find us there. They can also reach us through our Facebook page that we have. But to be honest, before I'm going to see a patient, I want them to have first been evaluated by a physician. So
Certainly.
I would really encourage them to speak with their sports medicine physician or with their primary care doctor about whether they think it'd be appropriate for them to come and see me or not, because I'm going to work in concert with the treating physician. I'm not going to see them alone.
I want to thank you both for your time this morning. Hopefully the snowpocalypse has not hit the Birmingham metro area just yet. But the information is just excellent, and thank you both for your expertise. I welcome you back at any point in time if there are other new information you'd both like to share on this subject. Again, I'm Bernard Nomberg with the Nomberg Law Firm. This is Nomberg Law Live. We're every Tuesday, or try to be, 10 a.m. Central Time. We'll be back again next week, hopefully interviewing Don Lupo with the Office of the mayor's office downtown. If y'all know Don, he really is one of the guardian angels of our city, and should be an excellent talk then. If you need to reach me, I'm at 205-930-6900. NombergLaw.com is our email address. Of course, we're on Twitter, Facebook, and YouTube. Hope you both have a good rest of your day, and those of you watching, have a good rest of your week. Take care.
Thank you. You too.
Thank you, Bernard.